Most medical insurers will post their medical policies right on their website. They're easy to find. You can either look at your patient's insurance card and visit the website listed, or come to Google or a different search engine and type the name of the insurance company. We'll use United Healthcare for this example. United Healthcare's website is listed right here. I'm going to click there. And when you get to the insurer's main website, there will normally be a few different sections, one for patients, one for providers, and one for investors. So make sure you navigate to the provider section of the website right here. And when you get to the provider section, you'll want to look for something labeled practice resources or administrative guides or medical policies. On United Healthcare, they have it listed under practice resources, so I'm going to click there. You'll have to continue on in to the United Healthcare provider portal, and once in, you'll see some quick links over here to the side, and their policies, protocols, and administrative guides are listed right there. On some websites, they'll be listed as medical policies or LCDs, and sometimes as CPDs. Here you'll find the medical and drug policies. There's also other types, but we want the medical policies. We'll have to agree to a disclaimer in most cases. And then you'll get a list or a search bar for all the medical policies that the insurer holds. If you have a search bar, use that and search for the type of policy you're looking for. Since this one doesn't have a search bar for me to use, I'm going to use Control F on my keyboard and type in the word sleep and search for that. Right here, non-surgical treatment of obstructive sleep apnea appears. When I click on this policy, the policy will appear, and the first part is normally just rationale and background and additional information about how they came to these decisions. And then you'll find a section that will give you the actual coverage criteria on what criteria a patient needs to meet to get coverage for the treatment. Okay. Now, you'll normally find a big section with a lot of clinical data and research in it, but if you scroll down to the end of most policies, you'll find this nice little section of applicable codes, where you can actually find out if the diagnosis and the procedure code that you're using are accepted by this insurer.